As doctors, we are tasked with learning a multitude of things. While much of this knowledge can be found in books or through surgical procedures, that alone is insufficient. As the old adage goes, merely possessing medical knowledge does not guarantee one will excel as a physician. And as a medical educator, it is essential to have a comprehensive understanding that extends beyond just biology or pharmacology. Recognizing the importance of principles and mastering effective teaching methods are also crucial. Let's explore this concept further with an example. First, do no harm. This is one of the most important principles in the practice of medicine. It reminds healthcare personnel to consider the possible harm that any intervention might do. It enforces that, given an existing problem, it may be better not to do something or even to do nothing than to risk causing more harm than good. So, how do we teach knowledge of similar characteristics in the best possible way? I am Eduardo Viteri from Ecuador, and teaching principles is the subject of this module. But what is a principle? Cataract is a fundamental aspect to teach to ophthalmologists. As you all well know, many things must be taught in order to properly train an eye surgeon to approach these cases in a safe and efficient way. And these aspects should be classified according to the content characteristics. So we have facts like cataract prevalence or concepts like lens opacities, the process of IOL calculation, the procedure itself, the surgery, and there comes the principles. When to operate, what kind of IOL are you going to use? So each different content should be taught in a different way. In a few words, principles are guidelines or criteria that can direct you in similar situations. Unlike procedures, there are no automatic or mandatory steps to follow in every situation. Each situation varies from another in some fashion. In fact, trying to follow a lockstep mechanical procedure might get you into trouble with situations that require you to apply principles. The key challenge is to identify the critical principles that best support optimal performance. To obtain clinical history and record main complaint, the doctor should follow important principles, like when to use open or closed-ended questions to identify the problems of the patient, how to use questioning techniques to direct the exam and gain information and insight. Handling complications or complaints require critical principles. Maintain presence, show empathy, address objections appropriately, and using check-back questions to check for agreement. When referring a patient to an attendant or a subspecialist, the physician must establish the need and urgency level for special care and make the arrangements and follow-up. You also teach principles to your patients. This is an example of a general rule for post-operative advice that a patient should follow when facing an elective but perceived harmful activity until they can ask the physician. When it does, don't do it. Principles should be trained at the application level of performance. This means that trainees must practice successful implementation of guidelines in a variety of job-related situations, often presented as case studies. Analogies are especially powerful in training of principles. But to work, the analogy must be familiar to the students and its critical elements must link meaningful to the principle. Like handling a complicated patient is like handling an egg. Is more familiar to more people than handling a complicated patient is like tuning a performance automobile. An analogy has to do with comparison of things based on those things being alike in some way. For example, one can make a draw or analogy between the seasons of the year and the stages of life. To evaluate principal learning, measure the participants' proficiency in meeting the skills criteria in context. Use role plays and skills performance assessment sheet to determine proficiency. This evaluation is better done by skilled evaluators using behavioral criteria. It is important to use behavioral checklists, that is, checklists that list behaviors that illustrate the principle in action, and that the evaluators are well trained in recognize these behaviors in action. Try to teach principles as much as you can, much more than formulas or data. Understanding is more important than memorization. So we invite ophthalmic educators to take this course offered for free by the Ophthalmology Foundation. Here you will find extensive information on these and many other topics of great importance. You can register just by clicking on the link accompanying this video. We are waiting for you.